Good morning, students. For those that do not know me, I'm Sherry Cusinelli. I'm the nursing instructor at the Carrollton campus. And this morning, it's time for me to put in my Mediport catheter, well, not the catheter, but which is like this, but I'll be accessing it with the Huber needle. But I wanted to show you. Now, mine is not exactly like this because I have a Groshon catheter that it's attached to the Mediport, and this is just a round hollow port that has a silicone covering where you put your needle in, and it's up under the skin. As you can see, this little lump on my over here, it's kind of a lump. Now I've had some troubles because 2 weeks ago I put on my adhesive dressing and had not done the skin prep, and I'm very sensitive to that adhesive dressing, and I'm just healing from the blisters that I had from that. Also, before I get started, I wanted to show you, I'm not sure if this is a Broviac or a Hickman central catheter, but I just wanted to show you the multi-lumens that is talked about in the lecture so you can get an idea about that. And you can see this one has an injection port on it, and they're different colors. It even has numbers to say what is the maximum pressure, either like 5 or 10 mils per second, it says. And so I just wanted you to be able to see that. Of course, this would be tunneled in and would go probably to the superior vena cava. Alrighty, I'm going to move these out of my way. Okay. And now I've got a mirror here because I have to look in the mirror to make sure that I'm doing everything just right. But the first thing I want to do, I have cleaned my table already, and I put a little drape down because I want to get my needle primed. So I'm going to take my, I didn't get me a little trash can. Okay. This is my, oh gosh, I can't even think this morning. I don't feel like I had much sleep. This is my flush. And remember, I may have mentioned that you want to pull back on the plunger and then get the air out. Okay, then I'm going to, this is the injection port, and I'm going to open this up. And this is sterile. I do not need to clean it at this point. And I'm going to, I like to have like a little bubble on top. Push in and turn. Okay. Alrighty. Now I want to keep this as sterile as possible. In the home situation, it's not as possible as it would be in the hospital, but because I'm having to do it to myself, I have to do things just a little bit different. But because I want to keep this as sterile as possible, I manipulate my tubing to get right up here into a corner. And it may not necessarily be the corner that says to where to open, but I just push it up so that when I open it, I can grab just this part. Okay, so here we go. I'm going to open it up. And I'm going to do it so that it sticks up and I can grab it. And then I just hold it inside the packaging. Alrighty, and then I'm going to take this sterile top off and connect. Okay. And I'll leave it inside the packaging while I am priming it. And if you'll notice, there's a little rubber injection port. It makes a Y injection port. And I'm going to put that down. And hopefully my air bubble is not going to stay there. But sometimes I will have an air bubble right there. Okay, so I'm going to push this in and kind of watch it go around. and then it'll drip out the needle. And then at that point, still in the packaging, I'm going to clamp it. Okay, this is what I have figured out to have it as sterile as possible. Okay, now then, I'm going to lay it on my table, and I'm going to open it up. It's still, now these syringe flushes are not sterile. Of course, the tip is sterile, and the solution, the saline, is sterile, but the outside is not. Okay, now then, we got that out. And I've got out my, didn't want to forget to put my skin prep on. In fact, I'm going to get another one. And I'm going to do 2 of them today, because I do not want to risk having that, because I noticed it seemed like it dried before I could get it, like my little sponge dried before I could completely get it all around. And so I'm going to even go further outside than I even think that the adhesive bandage will be, so that I don't get those blisters again. Now, I used to get a dressing change kit that these were inside, and that was much better, because then I could pick this up, I'd have my sterile gloves on, and I could open this up and everything would be sterile. But I went for a cheaper one, and it does not have these. So again, I have to kind of break the rules just a little bit and not be as sterile as you would be if you were in the hospital setting. Of course, you will learn that home care does relax a little bit on the standards, because all the germs that are in my house, I have antibodies to. But still, I don't want to minimize that. It's very important to me that I keep it as sterile as possible. So I'm going to lay those there. Okay, now then, I need to open up my dressing kit. You want to, of course, open it so that you're not going over the contents, but just pull that away. And I have to kind of work with it a little bit. It's tight. Okay, now then. Alrighty, I have a mask that I'll put on. Now some of these, probably the ones that will be in your hospital setting, will have 2 masks. And one's for the nurse to put on, the other one's for the patient to put on. But sometimes if your patient is cooperative, they can just turn their head opposite direction and not have to have the mask on. But of course, you would just follow your procedures for your facility as to whether they want the patient to put the mask on or not. Okay, I'm going to go ahead and put my mask on. I hope you'll be able to still understand me talking through this. And then I'm going to carefully pick up the sterile gloves. I'm touching like the outside package, and then I'm going to open it. Let's see if I get it right here. Now I have already washed my hands. And I'm going to put these on. Okay, now then, this inside of this sterile glove packaging is also sterile, so I'll just use, it comes with the sterile drape, but I have found other uses for this, and I hardly ever put out a sterile drape over my glove packaging. This is nice when I do my infusion, when I prepare my medications on my kitchen counter. I can use this because it's waterproof. And so when I'm working with my IV fluids and my medications, it's nice to protect my countertop with this. The vitamin C that I use is very sticky. And I don't know if I said at the very beginning, the reason I have this Mediport is because I have ovarian cancer. And I have been fighting this for almost 6.5 years now. So instead of doing chemo, I'm doing high dose vitamin C and some electrolytes and watching my diet, no sugar, no animal products and things like that, to give my body the best chance for healing. So I'm very particular about toxins and things of that nature. But I'm doing really well. And so let me go ahead and continue on here. So I will just lay this aside. Of course, this is all sterile. It comes with some tape that I will not use and some alcohol. Now this is what I will need, that I will use out of this dressing kit, is my, this is a ChloraPrep, which is the I can't even talk this morning, chlorhexidine, I can't even talk. I knew I should have got more sleep last night. And but this is the preferred method of cleaning. Some older doctors still like to use the alcohol betadine. So you would put your alcohol on, let it dry, then you'd go over that with the betadine sticks and let that dry, and it takes a couple of minutes for that. But I personally do not like that because it's so ugly and messy looking with that orangey stuff on your skin. And then the only other thing that I'm going to use out of here at this point is my transparent dressing. So I'll lay that there. Now there's some little gauzes in there that I use. I don't throw that away because when I get ready to take my needle out at the end of the week, because I just leave it in for a week, I will use one of those little gauze pads because occasionally I'll get a little bit of blood on my skin after I take the needle out. And if you noticed, I have these sterile gloves on. It's just out of habit. I linked my fingers together and I'm holding out above me to make sure that I maintain my hands being sterile. And I realized that working on this small table like this, it's low, that my hands will go below my waist. But we want to make sure that we keep our hands above our waist and below our shoulders. Okay, I'll open this up, and it's going to have 3 swabs in there. Okay, and I'm going to start in the middle, and I'm just going to go back and forth in the middle, really, really good. And then I'm going to go around and keep it flat on my skin and just making a larger and larger circle. I hope I don't have problems with the, I'm just going to lay that off to the side over there. I hope I don't have problems with, then I'm just going to do the very same thing for 3 times. Go around, problems with having the blisters, the skin irritation. And then last week when I was accessing my Mediport, I think I stuck myself, well, I didn't stick myself but twice, but I couldn't get a blood return. And so I would just pull back on my needle, but not out from the skin. It would still be in the skin. And I thought, well, why am I not getting any blood return? And I tried several times, so I finally took the needle out and got me another one. Still having the very same thing. And I'll tell you, the only thing different I did was I prayed. That's all I can say. I just like, Lord, what am I going to do? Have I got to go and get a new Mediport? I know they're good. I'd heard that some people even keep theirs for 10 years. But see, I use mine so often. So I don't know how many years I'll be able to use it. So that's what I was thinking when I couldn't ever get a blood return. So the third time, third try on my second needle, the blood came out, and I was just rejoicing. Okay, so now then that has to dry, and it takes at least a minute for it to dry. So I wait here while it's drying, and then I will be putting my needle in. Let me go ahead and okay. See, I wish that syringe was sterile. Then I wouldn't have any problems with touching it. So I don't touch it at this point because I have not accessed the port, and I want to keep everything as sterile as possible. And I'm looking in the mirror, and I can see that it's just about dried. There's still a little bit of sheen on it. When I first started doing this, I was so particular about everything, and the nurse that had I had to check off with a infusion nurse to make sure that I could do this and I could handle this at home. So when we were working together, she had said, now you got to let this dry for a minute. So I would stand here and I would count for 60 seconds. But I don't count anymore. I just kind of look in the mirror and I can see whether it's still shiny, and it looks like it's completely dried. So I'm going to take the protective cover off of the needle, and you can see that it's a 90-degree needle. Okay, so I'm sterile. I have sterile gloves on, and I've cleaned this area, and I like to feel, because there is a hard ridge around the Mediport, and I can feel that, and I want to get in the middle of that. So I like to just feel. I just feel better about feeling. And then I'm going to hold my Mediport. I'm going to stabilize it. And then, okay, we're ready to go. I've got my needle primed, and I'm just going to stick right there in the middle and just push right in. Okay, now then we'll see. Now I've got to touch this, and I'm going to unclamp it. And what I have experienced is that if I give my port not my port, but my humor needle, just a little bit of saline flush before I aspirate, it seems to do better. As I was saying, I have a Grosjean catheter in, has a 3-way valve, and it seems to me to work a little better if I just a smidgen, just a little smidgen. Okay, so when I've done that, now I'm going to pull back. Oh, look at there. I got a good return. Thank you, Jesus. Thank you, Jesus. And then I will finish infusing. And I see a little air bubble in my syringe, so I want to, for sure, not put that plunger all the way down, because that air bubble rises up to the plunger there. And I will not go all the way, because I don't know if you can see that air bubble, but I'm going to be very careful not to get that air bubble in there. Okay, so I'm going to stop about right there. Okay, and clamp it. Okay, now then, just let that hang, and I will be ready to, don't want to put my dressing on. That's what I did the other day. Put my dressing on before I had my skin prep on. This dries so quickly. I mean, you probably saw the little drops fail when I took it out of the thing. But I'm going to do 2 because it just dries up so quickly. And I'm going to go more on the outside. Okay, now then, as you can see, this has got a little, I don't know, a little handle, I don't know what you call it, or what the real name is, but it gives you something to hold on to while you are putting it in. And when I was taking infusions just once a week, I left that on because it made it really nice to, when I got ready to take out the needle, to hold on to that and pull it out. But since I'm going to be having this in all week, it doesn't look very nice under my clothing, and it makes it kind of a little bit harder to put the dressing on. Okay, I understand that I ran out of memory space on my iPad while we were doing this recording, and so you missed seeing me put the dressing on. It's a transparent dressing, and I don't know if you heard the part about there was a little clip thing that's on this Huber needle, so I have to really support it and pinch it to release it, and then I just throw it away. Okay, and then of course I still have my sterile gloves on, and I apply a transparent dressing. And as you can see, it's not easy to get all the wrinkles out, especially when you've got this bulge in the center, but you just have to do the best you can and make sure that it is very, it's down very good around your skin. Okay, I think that's all, and that'll conclude. I'm just really sorry that it didn't have the continuity of seeing it from start to finish. But anyway, I'll see y'all in a little bit because I'm going to get ready to do part 2 of your next video on how to give the IV meds. So bye until I see you next time.